So we'll begin our chapter principles of toxicology. So in this lecture one, I'm going to cover topics related to introduction to toxicology, then subdisciplines of toxicology, then spectrum of undesired effects, characteristics of exposure, and dose response relationship. In my next lecture, which is in next month, I'll be covering topics like assessing toxicological responses, variation in toxic response, toxicity testing, and systems toxicology. So we'll begin with the introduction to the toxicology. Toxicology is the study of adverse effect of chemicals, biological or physical agents on living organism and the environment, which includes naturally occurring harmful chemicals like toxins and foreign substances like xenobiotics. Toxins are naturally produced poisons from plants, microbial organisms, and venoms from animals, which is used to injure the predators. The examples for these are cyanogenetic glycosides from plants, then aspergillus fungus on corn and nuts, which produces aflatoxin, which has a risk of cancer to liver, and as we know, venoms from snakes or scorpion. Xenobiotics. This includes variety of synthetic chemicals with various intended purposes. Examples is pharmaceuticals developed to treat the diseases, then pesticides used to deter the pest, and also the herbicides which is used to control or eliminate unwanted weeds. In addition, there are a large number of industrial chemicals used in manufacturing processes.
Doctor, you are on mute.
You're on mute, Dr. Prashant.
Okay. So where I was on mute, hello.
You have completed xenobiotics.
Okay, xenobiotics. Xenobiotics include variety of synthetic chemicals with various intended purposes. Examples is pharmaceuticals developed to treat diseases, and then pesticides used to deter pests, and then herbicides used to control or eliminate unwanted plants. There are certain chemicals, a large number of chemicals, industrial chemicals, which are in manufacturing processes. For example, dioxin, it is also called as TCDD, produced during the production and combustion of chlorinated organic chemicals, causes a unique skin toxicity called as chloracne. Also, there are some naturally occurring chemicals or which are made due to human activities, which are called as polyaromatic hydrocarbons, produced by combustion of organic matter, that is, forest fires, coal combustion, or even through cigarette smoking. There is also a term called as toxicant. Now, this is a toxic chemical not produced by biological system, even if naturally occurring. Example is arsenic, which is a natural contaminant in water. Also, there are a lot of sources from where the arsenic can come. So we'll move towards next part, that is classification of chemicals. So chemicals can be classified on the basis of physical state, which can be gases, dust, or liquid, or also depending on their sizes, that is nanoparticles, on the basis of chemical stability or reactivity, or on the basis of chemical structure, or on toxicity levels, or biochemical mechanism of actions, and on depending on descriptive categories, which is air pollutant, occupation related exposures, and acute and chronic exposure. Virtually every known chemical has potential to produce injury or death if present in sufficient quantity. Paracelsus, a Swiss, German, Australian physician, scientist, and philosopher, aptly expressed this idea by stating What is there that is not a poison? All things are poison, and nothing is without poison. Only the dose determines that the thing is not a poison. This concept is often encapsulated in the phrase "the dose makes the poison." Many chemicals differs in their ability to produce serious injury or death. On your left side, you can see a table with approximate acute LD50 values for some representative chemicals. On top of the on the top of the table, you will see a relatively harmless chemicals which may be safe even at the doses exceeding the several grams. And at the below below of the table, you will find there are extremely poisonous chemicals which can cause death in micrograms. Now, there is some limitations for acute lethality measures that LD50 does not fully capture the spectrum of toxic responses or hazard associated with the exposure of chemicals. For example, chronic effects of some chemicals after repeated exposures may cause carcinogenic, teratogenic, and neurobehavioral effects at doses that do not produce immediate injury. Now, again, there are some factors like individual variability which influence the susceptibility. These factors are age, genetics, diet, underlying diseases, and and exposure can affect susceptibility to toxic responses. Now, a single chemical can have multiple effects also. So, in an organism, each with its own dose response relationship. We'll understand about the toxicologist. A toxicologist is an individual trained to examine and communicate the properties of toxicants and identify ways to prevent or mitigate harm to human, animal, and environmental health. So, what does toxicologist do? Toxicologists conduct a toxicological research which identify the cellular, biochemical, and molecular mechanism of toxic chemicals, which determines the extent of functional perturbation in critical organ systems. Using this data, toxicologists evaluate the relationship between toxicant exposure, that is dose, and response, that is outcome, to estimate the
What do you do,
probability
buddy?
of adverse effect. This determination requires an assessment of risk. Now, what is risk? Risk is the quantitative estimate of potential effect of chemical on human and environmental health at specific exposure level. For example, pesticide residues in food, contaminant, and drinking water, etc. So, the variety of potential adverse effect and diversity of chemical make a toxicology broad applied science. So it has interdisciplinary nature, which toxicology draws upon multiple disciplines including chemistry, biology, physiology, pathology, pharmacology, molecular biology, physics, and statistics, and more. So we'll move towards next part, that is subdisciplines of toxicology. Professional activities of toxicologists fall into three main categories. First one is mechanistic toxicologist, second is a hazard assessment toxicologist, and third is a regulatory toxicologist. All of these have distinctive characteristics, each contribute to other, and all are vitally important. So first, we'll focus upon mechanistic toxicologist. A mechanistic toxicologist identifies cellular, biochemical, and molecular mechanism by which chemical exert toxic effects on living organisms. In risk assessment, the mechanistic data may help in determining outcome observed in the lab animals. For example, the cancer and birth defects which was found in lab animals, whether they occur in humans or not. Also, it can predict some toxicity. For example, organophosphorus insecticides has a common mechanism, that is inhibition of acetylcholinesterase enzyme, which which is the symptoms are similar across the species in humans, rodents, and insecticides. Also, there is another example of artificial sweetener saccharin, where the mechanistic studies showed bladder cancer in rats, which is irrelevant to human at normal dietary intake due to differences in urine concentration. Generally, the bladder cancer occurs when the saccharin is in such a high concentration where it precipitates in urine, and which this thing is this type of precipitation is not found in humans at high doses also. That's why there is no bladder cancer seen in the human. Now, this mechanistic data are also useful to design a safer chemical, which aids in creating safer alternatives and therapies for chemical poisoning. Like well-known drug that is thalidomide, which was used earlier in as a sedative in pregnant women across Europe and Australia, was banned in 1962. The reason was it interfered with the expression of genes responsible for blood vessel formation. That's why the blood vessel were not forming in the limb, particularly in the limbs, and that's why the term was called as phocomelia. Later, this drug was repurposed for treating the diseases like leprosy and multiple myeloma based on its unique molecular mechanism. Next, we'll move towards hazard assessment toxicologies. So, most of the CRO here will be performing this hazard assessment in various species of animals. So, the hazard assessment toxicologist conducts toxicity testing that provides comprehensive information for the evaluation of chemical safety and to meet important regulatory requirements. So, most of the regulatory requirements are from OECD or ICF guidelines. The appropriate toxicity test in cell culture system or experimental animal are designed to yield information to identify potential hazards and associated risk posed to humans and environment from the exposure to specific chemicals. Now, hazard is a chemical or action that causes a harm, whereas the risk is likelihood for hazard to result in harm. Risk is determined by extent of which exposure to hazard. Now, toxicologists must be concerned not only with the risk posed by the company chemicals or to humans, but also with potential effect on fish, birds, and plants, as well as other factors that might disturb the balance of ecosystem. Hazard assessment studies in toxicology rely upon mechanistic experimentation to provide important clues to a chemical mechanism of action and provide valuable information used in the risk assessment performed by regulatory toxicologists. Now we'll move towards a regulatory toxicologist. A regulatory toxicologist is responsible for deciding, based on the data from descriptive and mechanistic toxicology, whether a drug or chemical posed a sufficiently low risk or in case of drug has favorable risk benefit profile to be marketed for a specific purpose. Now in USA, for various sectors, there are agencies and committees which has major legislation and responsibilities. For example, for drug and cosmetic, there is US Food and Drug Administrative FDA, which has major legislation of 1938 Federal Food, Drug and Cosmetic Act, which approves investigational new drug application to initiate clinical trials, approve pharmaceuticals for marketing under the new drug application, and regulate chemical exposure in skin creams, lotion, powders, makeup products. Same way for consumer products, the daily consumable products what we use in our household. There is a legislation for 1972 Consumer Product Safety Act, Federal Hazardous Substance Act, which established exposure standard for hazardous chemicals in consumer products like toys, creams, cleaning products require warning labels on products that are corrosive, toxic, irritant, or sensitizer. For food additives, there is a major legislation of 1938 Federal Food, Drug and Cosmetic Act, and then there is 1958 Delaney Clause, and then 1996 Food Quality Protection Act, which is which is under the U.S. Food and Drug Administration, which approves new direct additive, flavor, texture agent, preservatives, processing, etc. that can
Doctor, you're on mute.
I don't know why this is happening.
I think admin can do this. Maybe he is muting all. So
So, under the US Environmental Protection Agency EPA, there are many major legislations which establish exposure standard for pesticide, water, and air pollutants and hazardous waste. Prepare voluntary health advisories for drinking water and set ambient air quality standards. Same way for occupational exposure, there is 1970 Occupational Safety and Health Act, which set legal standards for worker exposure, including permissible exposure limits, PL or short-term exposure limits. Now, exam point of view, they might ask one of these legislation, major legislation, and what is it for? So you should know at least name. Year is not important, but what legislation is for what? At least one question will be there uh, regarding this federal agencies and everything. So there are other categories. This is forensic toxicology, applies analytical chemistry to toxicology, focusing on medico-legal aspects of chemical effects on animals and humans. For example, malicious poisoning by of animals or any person. And then clinical toxicology, which is concerned with diseases caused by uniquely associated with toxic substances, focusing on treating poison patients. For example, where there is arsenic or mercury toxicity, the treatment is done by DMSA or succimal to reverse the symptoms which is due to arsenic toxicity. Then environmental toxicology studies that effect of chemical on environment and living organism aiming to protect public health and ecosystem. Example, lot of acute studies are performed on Daphnia, earthworm or honeybees to assess the effect of chemical on environment. We will understand about the spectrum of undesired effects. Spectrum of undesired effects elicited by chemicals are broad. Mostly chemicals can produce a wide range of effects, some of which are harmful while others are not. Now, there are many prescription drugs, often have multiple effects, which one of them is for therapeutic use, and the other effects, other than therapeutic effects, which are other than therapeutic, are known as side effects. Now, these side effects are unintended action of drug, while some side effects can be beneficial also for other therapeutic uses. For example, this sildenafil was initially developed to reduce blood pressure, but during the clinical studies, number of male subjects reported as sustained erections. So after that, it was repurposed for treating erectile dysfunction due to its side effects of causing sustained erections. Same way, there is an adverse effect. Some side effects are always harmful and are
You're not
referred as
audible.
someone is muting, I think so.
It's audible, very much audible.
You're audible. You're audible. You're audible.
Breaking tempo. So some side effects are always harmful and are referred as adverse, deleterious, or toxic effects. These effects can negatively impact the well-being of animals. For example, irreversible effects on organ systems such as urinary, mainly involving kidney and CNS systems. Or generally, when we'll consider in case of animals, it will be less decrease in body weights, which is more than 10% of body weight. Now there is spectrum of undesired effect, number of one of which is allergic reaction, which is also called as chemical allergy. It is an adverse reaction of immune system to chemical due to previous exposure to that chemical or structure is similar. So there is a term called for it is hypersensitivity. Generally, the allergic reaction can occur at very low doses after initial sensitization. For example, allergic responses to poison ivy or poison sumac is related to extent of skin exposure to urush oil present in the leaves. Now, why this hypersensitivity reaction occur? So most of these chemicals are not large enough and to means most of these chemicals are not large enough to be recognized by immune system and considered as a foreign substance. So generally these chemicals when they enter into our body, they must first bind with native protein to form an antigen. This antigen is called as hapten protein complex that stimulates the immune system to form antibodies. Generally, time period for this is generally 1 or 2 weeks is required to generate this type of immune system to form antibodies. Upon subsequent exposure to chemicals, the antigen is recognized by body antibody, and then this recognition leads to allergic responses ranging from mild to severe, including fatal anaphylactic shock. Now, there is a species variation observed during for this allergic reaction. In humans, it generally involves dermatitis, urticaria, and itching. And while there will be also conjunctivitis, sometimes asthma will find. But in guinea pigs, there is only sign that is bronchiolar constriction leading to asphyxia and also death. Idiosyncratic reactions. These are chemical idiosyncrasy. Normally, abnormal reactivity of an individual to a chemical based on genetic or other individual sensitivity factor and defined as responses that are qualitatively similar to that of observed in other individual but are often rare and occur at low doses during to an individual extreme sensitivity. This reaction can occur at low doses and often not observed in most treated patients. These reactions are typically unrelated to therapeutic action of the drugs. Now, when the idiosyncratic reaction, those response are complex and involve several factors. So there is formation of reactive intermediate. This usually occurs through oxidation of electrophilic intermediate. Then body tries to detoxify this reactive intermediate, often through hydrolysis and conjugation. But still, the human leukocyte antigen and T cells may mount immune response and cause cell death. These reactions are also influenced by patient-specific factors beyond genetics, such as inflammatory stress, infection, mitochondrial dysfunction, and environmental factors. Symptoms do not occur immediately. It will take some time to means after starting a therapy mostly, or sometimes when therapy stop and when the therapy is again reinitiated, this medication can then there this can quickly trigger a reaction. Now the risk does not necessarily increase with higher doses. There is no dose dependency, and such reactions are rare, occurring in about 1 in 10,000 people. This reaction to the drug reaction can affect various organ systems with skin, liver, and hematopoietic and immune system being the most commonly impacted. So in skin, there will be mild rashes to severe conditions like Stevens-Jones syndrome. Drugs like piperacillin, abcavir, carbamazepine are known to cause such interactions. Liver reaction, this can be hepatocellular or cholestatic with drugs like halothane and flucloxacillin. Then hematopoietic reaction, these affect blood cell population can be triggered by medications such as heparin and chloramphenicol. Genetic factors like human leukocyte antigen HLA and metabolic enzyme play a significant role in these reactions. Also, there is third type of undesirable reaction, that is immediate versus delayed. So immediate toxicity effects that develop rapidly after single administration. For example, hydrogen cyanide or nerve gas like sarins. These chemical has rapid impact on main system like cardiovascular, respiratory, and neurological system, potentially leading to death within minutes. So uses to their high toxicity and quick action, these chemicals have been used in chemical warfare. Now, again, delayed toxicity, the toxic effect that may take months or years to become apparent. So there is a latency period for before symptoms are recognized. For example, carcinogenic chemicals, tumor may appear decades after exposure. Examples are diethylstilbestrol when prescribed to prevent preterm birth. Daughters exposed in utero have an increased risk of vaginal cancer for 20 to 30 years later. Or OP insecticides, which causes delayed neurotoxicity due to degeneration of long axons in nervous system. Again, there is fourth type of effect, that is reversible or irreversible toxic effects. Now, reversible toxic effects that can be reversed if the injured tissue can adapt, repair, and regenerate. Example is liver and GIT tract, which has high regenerative capacity. The liver can recover from even acetaminophen toxicity through proliferation of hepatocytes and differentiation of stem cells. And GIT, rapid proliferation of crypt epithelial cells, allows repair and repopulation of intestinal villi after anti-cancer drug cytotoxicity. Now, irreversible toxic effects. These are toxic effects that cannot be reversed due to limited regenerative capacity of affected tissue. For example, CNS, which has very limited ability to replace damaged neurons. Exposure to neurotoxin like MPP plus leads to Parkinson-like symptoms due to loss of dopaminergic neurons. Cancer and birth effect, once they occur, they are often irreversible. Thalidomide exposure, which called phocomelia, which is again trunculated or missing links in children exposed to in vitro during sensitive development windows. There is four type of toxicity, that local or systemic toxicity. Now, local toxicity that occur at site of first contact between toxicant and biological system. For example, this chlorine gas, when inhaled, causes damage and swelling to lungs tissue at site of contact, potentially fatal with minimal absorption into bloodstream. Or tetraethyl lead causes skin effect at site of absorption. Now, also there is systemic effect where toxic effects require absorption, distribution of the toxic from entry point to a distant site. For example, tetraethyl lead, after initial local effects, it is distributed systemically affecting CNS and other organs. Indirect systemic effect like kidney damage after severe acid burn, where the toxicant does not directly reach the kidney. Now, again, there is target organs of toxicity, specific organs that are primarily affected by toxicant, not necessary where the highest concentration of chemical is found. Mostly the lead, you'll see it will accumulate after exposure, it accumulates in bone but causes toxic effect in the brain. Like also example of DDT generally concentrates in adipose tissue but primarily affect our brain and female reproductive system. Understand about the interaction of the chemicals. We as individual encounter multiple chemicals daily through sources like cosmetic, medication, or even through their diets. Now, understanding chemical interaction is crucial as they can impact physiological process such as absorption, protein binding, receptor signaling, biotransformation, and excretion. Now, we'll understand the types of chemical interaction. First one is additive effect. So here you can see chemical A, B, and C. Okay, so additive effect, combined response of two chemical equals the sum of their individual response. For example, 2 plus 3 is equal to 5. Example for this is two organophosphorus insecticides inhibiting acetylcholinesterase enzyme. So generally there will be addition of the effects, and the response will be same, means toxicity will appear same, or means addition of that. So synergistic effect, combined response of two chemical is much greater than the sum of their individual responses, that is 2 plus 2 is 20. Example, carbon tetrachloride and ethanol causing greater liver injury together than individually. Synergistic, and after synergistic there is potentiation. There is in this one non-toxic substance increases the toxicity of another chemical, that is 0 plus 2 is equal to 10. For example, isopropyl isopropanol enhancing the hepatotoxicity of carbon tetrachloride. And also there is the antagonism where two chemicals interfere with each other's action, reducing overall toxicity. That is 4 plus 6 should be 10, but it is 8. Now there are four types of antagonism. So there are four types of antagonism. First one is receptor antagonism, where two chemical bind to the same receptors, okay, producing less effect together than separately. That 4 plus 6 is equal to 8. Or one chemical reduces the effect of another. That is 0 plus 4 is equal to 1. Examples are naloxone treats morphine overdose by competitively binding to the same receptor. Then tamoxifen lowers breast cancer risk by blocking estradiol from binding to its receptor. And third example is atropine, which is used in treatment of organophosphorus insecticide poisoning by blocking acetylcholine receptors. Then chemical antagonism, you'll find there is a receptor and there are two chemicals. So what will happen? These two chemicals will react with each other, and then there will be a direct chemical reaction between two compounds, produces a less toxic product. For example, DMSA or succimer chelates metal ion like arsenic, mercury, and lead, reducing their toxicity. Or there is again another protamine sulfate, which forms a stable complex with heparin, abolishing its anticoagulant activity. Third type is dispositional antagonism. So here you can see there is chemical A, chemical B, and receptor. So alteration in absorption, distribution, biotransformation, and excretion reduces the concentration, duration of a chemical at a target site or at a target organ. Example, activated charcoal, which prevents the absorption of toxicants. Or there is osmotic diuretics, which increase the excretion of chemicals through urine. So it will be not absorbed easily and it will be thrown out of the body. Also, there is phenobarbital, which increases metabolism of warfarin, reducing its toxicity. And Piperonyl butoxide inhibits the biotransformation of parathane, decreasing its toxicity. Then fourth one is functional antagonism. Here there are different receptors on a organ. So when two chemicals produce opposing effect on the same physiological function through different signaling pathways. Example is norepinephrine, which counteracts the blood pressure drop caused by barbiturate intoxication by activating alpha adrenergic receptors. Also, there is one term called as tolerance, which is reduce pharmacologic and toxicologic responses to chemicals after repeated exposure. Now, there is also a term called as cross tolerance, which occurs when chemicals are structurally similar. Mechanism of tolerance, generally there are two types: dispositional tolerance, where decreased amount of chemical reaching the site of action over time. Example, phenobarbital increases liver enzyme expression, enhancing its biotransformation to inactive products like biotransformation enzyme induction. And second one is chemical or cellular tolerance, where reduced availability of receptor and or mediators. Example, neurotransmitters. For example, morphine interacts with opioid receptors. Repeated exposures leads to beta arrested to binding to the receptor, causing desensitization and tolerance. So we'll understand about characteristics of exposure. For toxicity to occur in biological system, sufficient concentration of active form of chemical must accumulate at site of action for requisite amount of time. Many chemicals are low in toxicity in their native, also called as prodrug, but become toxic when metabolized in the body by liver enzyme CYP450. Examples are digitoxin. Normally, it is metabolized in the body, and this active form it is converted to its active form called as digoxin. Also, for morphine, it is converted to morphine 6 glucuronide. Thus, Thus, when a toxic response occurs, it is dependent on various factors such as chemical and physical properties of chemical, exposure scenario, metabolism of chemical, that how the biological system is metabolizing that chemical. concentration of active form of at the target site, and susceptibility of biological system to injury. In order to characterize fully the potential hazard of specific chemicals, one needs to know not only the type of effect it produces, also the dose required to produce that effect, but also information of chemical exposure and disposition. So there are two types, major two factors which influence the toxicity. First one is route of exposure, and second one is duration of the exposure. So we'll understand about the route and site of exposure. Major route is gastrointestinal tract. Majority of toxicants enter into the body through gastrointestinal tract, then lungs, and then through skin by topical, percutaneous, or dermal. Dermal route. Greatest effect and rapid response is when given intravenously, when the test item drug is given directly into the bloodstream. The effectiveness of other routes is after IV, it is inhalation, then intraperitoneal, IM, subcutaneous, intradermal, oral, and dermal. I think so. In book there is a typographical error what I have observed, where they have mentioned that SC is faster than IM. So I don't know, but I think it is a typographical error. Vehicle and formulation ingredients can also alter absorption after ingestion, inhalation, and topical exposure. Route of administration can also influence the toxicity. For example, oral versus inhalation. Here, a chemical given orally could be less toxic as it has to go through liver and get detoxified. Occupational exposure, inhalation, and dermal contact generally will happen through breathing contaminated air or with prolonged contact with substance to the skin. And accidental and suicidal poisoning generally will happen through oral ingestion. So, comparison of toxic doses for a chemical by different route to provide information about the extent of absorption in the body. When there is similar TDs, toxic doses for oral, dermal, and intravenous route indicate the rapid absorption of the drug into the body. When there is higher TD for dermal route, suggests that effect took skin barrier and drug is not absorbed through the skin. So now influence of concentration and vehicle properties. Toxic effect by any route of exposure can also be influenced by concentration of chemical in its vehicle, total volume of vehicle, and properties of the vehicle at the rate at which it is the properties of the vehicle and rate at which exposure occurs. So we'll understand about duration and frequency of exposure. So acute generally exposure is less than 24 hours, but can be single or repeated administration within 24 hours. For inhalation, continuous exposure for less than 24 hours, typically it will be for 4 hours. Then for repeated can occur through any route, but most of the time it is oral. Subacute generally it is a repeat exposure for 1 month or less. Subchronic it is repeated exposure for 1 to 3 months, and chronic repeated exposure for more than 3 months, often at least for 1 year. Now, human exposure frequency and duration of human exposure is less defined compared to control animal studies. Term used are again acute single incident. For example, we know this Bhopal gas tragedy where methyl isocyanate leakage was happened in 1984, causing acute toxicity exposure to about 2 lakh people and fatalities of approximately 2,000 in first 24 hours. Subchronic or repeated over weeks or months. Example is lead exposure causing neurological defects in children and worker exposed to it. Also, the chronic repeated over months and years, long-term effects of ethanol. Example is liver cirrhosis and cigarette smoking (COPD) to be observed. Variation in toxic effects. For many chemicals, the toxic effect that follow single exposure are quite different from those produced by repeated exposure. Example is benzene, which causes CNS depression when acutely exposed, but bone marrow toxicity and increased leukemia risk with repeated exposure is observed. Acute versus chronic exposure. Acute Exposure rapidly absorbed, show immediate toxic effect, but can also cause potentially delayed toxicity. Conversely, chronic exposure can also produce immediate effect after each administration and long-term chronic effects. So toxicokinetic studies generally are performed by sampling or tissue at various time after exposure. This determine chemical concentration and understand exposure influence on toxicity endpoints. Concentration time profile for a given chemical are influenced by the frequency of exposure. So relationship between elimination rate and frequency of chemical exposure is shown in this figure. So you can see chemical A, which has half-life of almost 1 year and slow elimination. Then chemical B with half-life of a day, and which is equal to frequency of administration. And then there is chemical number C, which rate of elimination is faster than the dosing frequency. So considering as it has 5 hours of half-life. So normally, what will happen? You will see this when chemical with severe effect from single dose may have no effect if the same dose is given in intervals. So here in blue marking, you can see the concentration of chemicals at site to elicit a toxic response. So when it was given singly, it was showing toxic responses. But when it was given in repeated doses, it took almost 2 doses to reach, or 2 or 3 doses to reach at the concentration range of toxic response. Same way, chemical B reaches toxic concentration after multiple doses. If you consider this B, it took almost 4 to 5 doses to reach the concentration at toxic, while chemical A reaches it faster due to slower elimination rate. And chemical C, with fastest elimination rate, never reaches this toxic concentration regardless of dosing frequency. So we can understand there is influence of frequency on toxic effects. The frequency of exposure can be more critical than duration. In chronic toxic effects may occur if chemical accumulates in the system, produces irreversible effects, and insufficient recovery time between exposures. We'll move towards dose response relationship. So mostly the dose response relationship describe the association between the amount of toxicant, that is dose administered, and the extent of changes observed in the biological system, that is the response. So there are two types of dose: external dose, which is amount of chemical administered or measured in the environment, and internal dose, the amount of chemical absorbed found in the site of biological activity. So generally, expression of dose is done in mass or concentration. Dose can be expressed as mass or concentration. Unit depend on state of toxic chemical, whether it is solid, liquid, or gaseous. For example, for toxic chemical, when it is like acetaminophen, toxic exposure, if internal blood concentration exceeds 150 milligram per liter. For air pollutants, it is milligram per meter cube. And for lead in water, it is like 15 parts per billion, that is ppb, or 15 micrograms per liter. So types of dose response curve. So generally there are two types of response curve. First one is individual or graded dose response curve. It is a means response of an individual organism to increasing doses. So generally this type of response curve is found in a single animal, where we'll give doses with increasing amount. Individual dose response relationship are characterized by continuous scale of dose leading to an increase in magnitude of specific responses. For example, chlor, uh, chlorpyrifos, enzyme inhibition means this organophosphorus compound generally inhibit two enzymes, that is acetylcholinesterase and carboxylesterase in rat brain and liver. So dose related inhibition, generally degree of inhibition is dose related but varies between enzymes. Yeah, here you can see in this graph at 3 mg inhibit of dose inhibit cholinesterase without affecting the carboxylesterase. At 5 mg and higher, both enzymes inhibited with greater inhibition of cholinesterase. So for Toxicological response, primary response related to cholinesterase inhibition will be seen in the brain, and the clinical sign will follow the dose response relationship similar to brain cholinesterase enzymes inhibition. Now, there are certain presumptions for when we say that graded individual or graded dose response. A drug whose pharmacological effect is known and there is a receptor to which it will bind. So generally, in old, I don't know, during my college days, we used to do one experiment in frog muscles. We used to smoke the drum, and then the muscle was, I think, so skeletal muscle was put into that, and various doses of acetylcholinesterase we used to give to see the effect of that on the skeletal muscle. The same way, the drug whose pharmacological effect is known and there is a receptor to which drug binds. Response is depend on concentration of drug at receptor sites. Effect of drug is proportional to receptor occupied by the drug. Hence, increase or decrease in dose response also increases and decreases. The maximal effect is seen when drug occupies all the receptors. That is called as Emax. The dose response curve is parabola, origin at zero at the both axes. So it is considered that when there is no drug, the response, when there is no dose administered, the response is zero. That's why the curve which is formed is called as parabola. The threshold dose is the minimal dose that produces desired effect. A ceiling dose, effective dose, that is ED 100, a minimal dose that produces 100% of effect, that is Emax, and maximum effect or response, and also there is ED 50, that is effective dose, where 50% of animal will respond to that chemical. Second type is quantal dose response curve. Now, whatever we have seen, the dose response in single animal, in quantal dose response, distribution of individual responses to different doses in a population. So we'll study this in population. So quantal dose response relationship describe all or none response in population, where individuals are classified as either responders or non-responders at given doses. So there is contrast different from graded dose response relationship which occur on continuous scale in individual. So there is conceptual similarity that both quantal graded doses means generally these both are uh, mm, conceptually identical, means they will be plotted on x and y axis, which is called as ordinate and also abscissa. Effective dose. Now, effective dose is a widely used approach for estimating population response to a toxic exposure. ED50, the dose at which 50% of population responds. There are again variations which can be ED1, ED10, or ED30. Or lethal for lethal dose, the dose at which 50% of population dies. LD50 is of limited value as measure of hazard but provided a relative indication of serious poisoning risk. So LD50 is still a first experiment performed on various new chemicals. So there we have very limited value as measure of hazard, but it provides a relative indication of serious poisoning risk. For example, LD50 of lead or DDT is not relevant for characterizing hazard to children and wildlife. So dose response relationship normally typically exhibit a normal or Gaussian distribution forming a bell-shaped curve. So when histogram shows relation between dose and effect. So this bar represents the percentage of animal that responded at each dose minus the percentage that responds at the immediately lower dose. So few animals respond to the lowest dose and the highest dose, and with maximum response frequency occurring at intermediate doses. A bell-shaped curve is also known as normal frequency distribution. So there will be biological variation also, differences in individual susceptibility to chemical toxicity. Animal at the left, particularly at this side, are curved as hypersusceptible, while those at the right end are called as resistant. Cumulative control dose response. Adding the number of individual responding to each consecutive dose result in cumulative dose response curve. So which is plotted as sigmoid curve when the large number of doses with with large number of animal use per dose, the relationship often forms a sigmoid S-shaped curve. Now, this sigmoid curve has characteristics. Approaches 0%. It is considered that when there is no dose, the response is zero, and as the dose decreases, and approaches 100% when the dose is increased. But it normally does not happen. The minimal ED of any chemical, minimal ED of any chemical that invokes a started all or none response is referred as the threshold dose. So, normally distributed population response, the sigmoid curve characteristics normally relatively linear between 16 to 84. Now, it is considered that we need when we have to plot for ED50 or LD50, this sigmoid S-shaped curve will consider that from 16% to 84%, it is a straight line. Okay, they represent limit one, and this represent one standard deviation for mean in normal distribution. Now, the standard deviation in normal distribution for plus 1, plus minus 1, it is 68.3. For plus minus 2, it is 95.5. And plus minus 3, it is 99.7. So, there are few practical challenges. It is difficult to describe dose response curve due to small sample sizes and particularly challenging at low and high doses. So, so dose exploitation across the species. In field of toxicology, researchers often work across the multiple animal species, and in turn, there is need to compare the doses from one species to another. So, essential for comparing doses across the species, and especially in the drug development, where animal data generated are used to justify and design experiments in human chemical trials. While body weight is used to calculate data on for individual organism, it has limitations ineffective for generalizing doses across the species. So generally, after it's normally for individual for administration of drug to a individual animal or organism, will consider body weights. But here, when we are while body weights is used to calculate dose for individual organism, effective for generalizing doses across the species. So then allometry is used, which examines the relationship between body weights and biological parameters. For example, metabolism, heart rate. So there is a formula y is equal to AWB, where y is parameter of interest and A and B are constant that relate y to body weights. There are scaling parameters. So organ size between species scale best when B is equal to 1, and metabolic parameters scale better when B is 0.67 to 0.75. So generally body surface area is more effective to for dose estimation across the species, and this is done by formula SA is equal to 10.5 into body weight in grams into 0.67. So FDA recommendations for the first human clinical trial, FDA suggests using animal data, body surface allometry, and safety factor to calculate maximum recommended starting dose. So here you can see the left side will see the table where conversion of animal doses to human equivalent doses HD for 60%, 60 kg person based on the body weight surface area. So here you will need NOEL. So when there is NOEL, say for example, there is NOEL in animal that is 100 milligram. So you have to divide by, say, in rat by 6.2. And if you have this human equivalent dose, in this case, you have to multiply with this animal dose. For species not listed in the table, the equation HED animal dose in milligram per kg into animal weight in kg, animal weight in divided by human weight in kg. Multiply 0.33 should be used. Limitation of allometry scaling. Not all toxic responses scale the same way. Chemicals with renal excretion, minimal hepatic metabolism, limited tissue distribution, similar molecular target across species are more amenable to scaling. So nowadays computational modular physiologically based pharmacokinetic PBK model use physiological parameters to predict chemical disposition across the species It helps in estimating risk of toxicity and understanding the toxicodynamic effect. So there we'll understand about the shape of the dose response curve. So normally there are two types of dose response shape of dose response curve, that is monotonic dose response curve, where it first one is uphill or which is increasing dose response with the dose, figure A. So on figure A you can see when dose is administered, dose response increases. Also there is downhill, when dose is administered, response decreases with dose, here in figure B. A dose-dependent transition, important for understanding mechanism of toxicity. Different slope indicate changes in process like chemical activation, detoxification, receptor interaction, repair, and alter homeostasis. So non-monotonic dose response curves are generally U-shaped, that is valley shape here, first figure, where the response decreases at lower dose and increases at higher dose. J shape, which is similar to a U shape but with different inflection point. Inverted U shape, responses increases at lower doses and decreases at higher doses. And there is also roller coaster type where multiple inflection points with varying responses are seen. So generally, essential nutrients can exhibit U shape or inverted U shaped curves. Hormesis, some chemicals are beneficial at low doses but harmful at higher doses. Now, regulatory approach traditionally focuses on monotonic curves, but there is shift towards considering non-monotonic responses, especially for endocrine active chemicals. So, the threshold and linear non-threshold models. So, one of the important transition that occurs in the investigation of dose-dependent responses is found at the low doses. Normally, what we'll do, we'll test chemicals at say 250, 500, and 1000 grams. So we know that till 250, if NOL is there, but this part we need to explore. So exploitation of monotonic dose response at low doses can be performed by assessing threshold or using linear non-threshold exploitation. Exploitation. Extrapolation of dose responses at low dose. So this gray box represents the region where the empiric data are lacking, and the shape of the curves need to be extrapolated. So there are two approaches. First one is threshold approach, where which continues the linear regression. So this line is often straight line is considered and where it meet with the dose. This linear regression of experimental data maintaining the same slope. And the linear no threshold approach exploit the curves using the lowest data point. So it is considered at zero and regresses back to zero response intercept. This exploitation extrapolation is typically performed for genotoxic carcinogen. Now there is threshold concept. A threshold is a dose at which toxicity is first observed. Below it is considered that below this threshold dose, the probability of animal responding is zero. So linear or non-threshold models, generally these models assume a directly or proportional relationship between dose and response, even at very low doses. Identification of threshold depends on the particular response being quantified, influenced by sensitivity of measurement and number of subjects studied. Now, this threshold for toxicological concern, that is PTC, applied to non-carcinogenic chemical using qualitative risk characterization approach known as TTC. This suggests level of exposure below which the risk of human health is not appreciable. Application of TTC. Initially, it was proposed for food safety, now extended to cosmetic ingredients and impurities in pharmaceutical preparation. Integration of data in TTC generally include chemical structure, disposition, biotransformation, and toxicity use and is used to prioritize chemical for further testing. So non-monotonic dose response curve for natural or endogenous chemical required for normal physiological function. This type of monotonic curve is observed. Essential nutrients like vitamins, essential trace elements such as chromium, cobalt, zinc, manganese, and selenium. The graded dose response, the graded dose response relationship is an individual can be U-shaped. So generally, nutrients and vitamins concentration needed to be maintained within a specific range to allow homeostasis. So here, if dose is decreased, you will see deficiency. If dose is increased, it is toxicity, and death is observed here. So generally, you have to maintain the for essential nutrients and vitamins. You have to maintain the dose between these two, where the region this is called as region of homeostasis. Deficiency or toxicity. Doses outside the optimal range can lead to deficiency, very low doses, or toxicity at high doses. For example, manganese is found in all mammalian tissues needed for bone formation and metabolism of macromolecules. Works as cofactor for enzymes involved in important metabolic processes. But deficiency can lead to growth delays, seizures, and impaired fertility. And if there is excessive exposure, which can lead to neurotoxicity due to accumulation in brain. For example, there is other example like for vitamin A, which can cause liver toxicity and birth defect at high doses. And at low doses, you will see means less will have effect on eyes. High doses of selenium can affect the brain. High doses of estrogen may increase the risk of breast cancer, or low amount of these substances are essential for the life. Hormones, some non-nutritional toxic substances may impart beneficial or stimulatory effect at low doses, but produce adverse effect at higher doses. For example, radiation effect. Hormesis has been described for radiation effect. Alcohol consumption. It is well known that risk of esophageal cancer, liver cancer, and cirrhosis after consumption of alcohol. But low to moderate consumption reduces the incidence of coronary heart disease and stroke. Hormesis in chemical carcinogenesis is evaluated in animal, particularly in context of liver tumors in rodents. Example, TCDD. At low doses, TCDD reduce the number of altered hepatic foci, but at higher doses, TCDD significantly increased with the number of foci, indicating higher risk of hepatocarcinogenesis. Same way, DDT at lower doses decrease the baseline number of hepatic foci, but at higher doses enhance formation of foci. So generally, the dose response curve for both TCDD and DT exhibited a J-shaped curve. Now, evaluating the dose response relationship. The first one is therapeutic index, used to illustrate the relationship between therapeutic and toxic doses. Generally, it is defined as ratio of the dose required to cause toxic effect to the dose needed to produce desired therapeutic response. Now, this can be used for comparing the toxicity of various chemicals with different chemicals. Index of comparative toxicity is obtained by ratio of dose of two distinct material to produce an identical response, or ratio of the dose of the same material necessary to yield different toxic effects. So median effective or median toxic doses. So generally for therapeutic index, these two commonly used indices are median doses that elicit effective dose 50 or toxic dose T50 response, that is response of 50% of population. TI is expressed as the ratio of adverse endpoint, that is TD50, to the effective therapeutic dose ED50. So generally TI is calculated by TD50 divided by ED50. The larger the ratio, greater relative safety is assumed. For example, if ED is approximately 20 and TD is about 60, the TI is 3. So the number indicate the reasonable care exposure to the drug is necessary to avoid toxicity. Then there is margin of safety is calculated using formula TD1 divided by ED99, used to indicate safety margin between effective and toxic doses. So non-drug chemicals, for chemicals with no beneficial effect, dose or repeated exposure, the ratio of TD1 to 91 has little value. In risk assessment, MOS, margin of safety, is used to compare estimated exposed dose to human population with the no observable adverse effect, NOEL, and other benchmark dose determined in experimental animals. So again, there is a chronicity index. This is a measure of degree of accumulation of chemical and its toxic effects. It is calculated mostly by TD50 acute dose divided by TD50 90 days. If no cumulative effect occurs, the chronicity index is 1. And if cumulative effect occurs, the index could be as high as 90. So repeated dose studies, mostly the dose response curve from subacute, subchronic, and chronic studies are used to estimate NOEL or other benchmark measures to minimal measures of minimal toxic responses, such as TD10, dose producing toxic effect 10% of the population, that is margin of exposure. Margin of exposure is index comparing the estimated daily dose to chemical with NOEL or benchmark dose, that is TD10. It is expressed in ratio. For example, exposure to pesticide residue is 0.001 milligram per kg day and TD10 is 1. The MOA could be 1000, indicating that the daily exposure is 1 to 1000 of dose causing toxicity in 10% of exposed animal. So there is again few variables of curves. The first one is efficacy. Efficacy is maximal effect produced by a drug. So uh, there is few definitions which I wanted to include as an agonist, which produces a maximal response, has maximal efficacy. So here you will see that chemical A and B are two drugs having same efficacy but different potency. So this agonist will produce this maximal effect. Partial agonist will produce poor or lower efficacy, and antagonist has zero efficacy. So it will not produce any efficacy. Potency is amount of drug to required to produce an effect. So the amount of drug required to produce a certain effect. So position of this curve, uh, generally the position of curve at left is potent and right side it is less potent. So here the response is seen in low doses. That's why the position of curve matters in potency. At low doses, curve will be a little bit towards left side, and at when that there is toxicity at lower doses, the curves will be at right side. Slope of curve. If the curve is steep, indicate more binding that and that the chemical has more affinity to the receptors, and flat. When there is flat, there is less affinity or binding to the drug to the receptor. Again, there is variance. The appearance of difference in magnitude of response of individual in a population given in the same dose of the drug. Thank you.